Hello, I'm Dr. Derek Enlander, a physician in practice in New York with a particular interest in immunology and virology. Obviously, over the past few weeks, I've been inundated with questions about the COVID-19 virus epidemic. The COVID-19 virus is an RNA virus, highly infectious, and it was thought originally to infect mostly the mature population. It has actually recently been seen to also infect children, and the CDC have termed the condition MISC, multiple system inflammatory disease in children. MIS-C infects children by creating a fever, a rash, abdominal pain, and the child actually then becomes acutely ill. In the adult patient who is infected with the virus, 80% of the patients who are infected with the virus are asymptomatic. They do not have symptoms. 20% of the patients infected with the virus, their symptoms are breathlessness, fever, pain in the chest, and they have loss of sensation of smell and taste. The virus actually rapidly replicates and infects the respiratory system and can actually rapidly produce viral pneumonia. A patient actually walks into the emergency room and rapidly is then transferred to the ICU and can actually then be immediately put on a ventilator because the patient has difficulty breathing. The virus is an RNA virus which is related to the Sars virus, SARS epidemic virus, the serious acute respiratory system virus seen in 2003 and 2002. This epidemic created problems worldwide. Later, in 2006, the MERS, Middle East Respiratory System virus, another RNA virus, created respiratory system disease in the Middle East. The SARS virus was thought to actually be derived from a mutation of a virus from bats, and the MERS RNA virus was thought to be from a mutation from camels. The infection today is May the 15th, infected 1.3 million patients in the United States. 83,000 patients have died from this epidemic. The virus is passed by aerosol, by droplets from the patient who has been infected with the virus, and the droplets actually then pass in the atmosphere to be inhaled by unfortunate people who are in the vicinity. It's thought actually that the droplets can actually normally pass about 5 to 6 feet. However, with a cough or a sneeze, the virus transmission can actually be amplified to 12, 15 or longer distances. These 12 feet or 15 feet actually can actually create great problems. The problems actually rapidly pass into the alveoli in the lungs and create actually difficulty in the patient actually breathing and taking oxygen, and that's why the patient has to be intubated. The need for immediate hospitalization is obvious. There's no antiviral specifically for COVID-19. There's no antibiotic for a virus. There is no vaccine. And the idea of using existing substances has been tried. Hydroxychloroquine was initially suggested, but after a long-term use in many patients, the hydroxychloroquine use has been shelved. Remdesivir was an antiviral used in Ebola, and this actually has been used with some patients with the idea that it can reduce the stay in an ICU by 4 days. In the past, the classic approach to producing a vaccine is to have an attenuated virus or antigen, and the attenuated antigen actually is then used to produce an immune response in the patient to ward off an infection. The idea of vaccination was initiated by Jenner several hundred years ago when he did his classic experiments on chimaids who were seemingly immune from smallpox. And this was because actually they actually had immune reaction from cowpox in the cows, and the idea of vaccination was derived from the term vacus, Latin meaning cow. The group in the Oxford University in the United Kingdom has actually embarked on a new approach. The approach being that the sheath, the protein sheath of the virus, the capsid. The capsid contains protein, and it's the capsid which can actually produce an immune response in humans, and the capsid antibody is what the Oxford group, headed by Dr. Hill, are actually planning to produce a vaccine. The idea is that this vaccine can be produced more rapidly than the standard method, which is employed elsewhere. Viruses are parasites. They need a living cell to replicate. The COVID virus, like other viruses, can actually enter the cell, replicate within the cell, and the cell actually then produces multiple copies of the virus, and the virus actually rapidly spreads. Until we find a method to combat the virus, we have got to actually use caution in that patients actually should remain 6 feet from each other to actually reduce the transmission of the aerosol. They should wash hands thoroughly. It's suggested actually hand washing actually should take 20 seconds. And the idea of wearing a mask will protect not only the patient from breathing in the virus, but from patients actually breathing out the virus. The idea of distance from patient has actually produced good results in China and elsewhere in Europe. The idea of sanitization of handles, toilets, equipment with sanitization fluid has actually produced good results. The sanitization fluid contains alcohol and butyl alcohol, which kills the virus. Patients with immune incompetence, heart disease, high blood pressure, lung disease, COPD, diabetes, patients who are on cancer therapy are at increased risk and actually have to use extreme caution. Do not be tempted to resume activity, normal activity, too early. Social gatherings actually can actually produce a second round of infection, and obviously this has to be avoided. Consultation with your doctor should be frequent. These can be made by phone, Skype, or by the internet. Many doctors, including myself, make themselves available. I'm available if you so desire to talk to me at 212-794-2000, 212-794-2000. Keep well. I shall actually follow up with another talk in a week. Thank you very much.